The following program has been furnished and paid for by the Health and Wealth Power Hour, and KSCV is not responsible for its content or the product or services offered.
Welcome to the Health and Wealth Power Hour with industry expert and health insurance broker pro, Harlan Pickett. A show about how you can live longer with more cash and flexibility to really enjoy those years and never run out of money. Harlan will take your calls on a variety of topics related to health insurance, health care, retirement income planning, Social Security, thrift savings plan, 403b, 401k, or just about anything that gives you the tools to take action on keeping more dollars in your pocket and putting more dollars towards your retirement. He'll even share a few industry secrets if you listen close. And now, here's your host, Harlan Pickett.
All right, welcome aboard Health and Wealth Power Hour. It is great to be with you on this Thursday. We are super excited to be at the National Free Market Medical Association Conference. Got some outstanding guests. The founders of that organization are with us today, Mr. Jay Kempton and Dr. Keith Smith. We're going to talk a lot about what's going on. We're talking about the focus of the convention this year, and we are live here in Fort Worth at the Omni Hotel. It is not too late for you to come and join us, and there is also, if you can't get up here, there's virtual tickets that are available also. You can go out to FMMA.org and check it out that way too. So it is not too late to get engaged, learn more about it, and I am once again just honored to have such distinguished guests with us today. I was just talking with Dr. Keith Smith about what really the focus of this is, and before he could really even get into that, Jay jumped in and said the buyers. We got to have the buyers get into this because, you guys, you know, we talk about this week in and week out, that there are so many different and great options out there, but until you as the buyer, as the employer, until you really make that change and start adapting and offering true access to your employees, things are not going to change. It is interesting to me. I've learned here recently, have you guys heard of Bind? I just recently found Bind Health. And we're changing the world. We're doing this. We're making all these changes. If you really, and they're using the United Healthcare Choice Plus network. And man, all this sounded, no, it's like, wow, this is, I mean.
Can't wait
really,
to see the change.
No, they're really doing some great stuff. And then when you get down to the bottom, it says presented by United Healthcare.
Oh, my gosh.
Yeah.
I said, like everything else, right? Like every damn thing else out there presented by United Healthcare. Your doctor, your surgeon brought to you by United Healthcare, right? So it's so funny. The more things change, the more they stay the same, right?
Well, they're honest in their name, though. Bind, like bound.
I was like, I was trying to figure out what the catch was here, right? Yeah. I mean, bind, B-I-N-D, bind. I mean, like, what really makes me want to do this, right? And then as I realized what it was, I said, yeah, appropriately named.
The market needs to be unbound more than anything.
Exactly, and that's really what the focus of this is, right? I mean, the focus of the whole conference this year is
empowering buyers to start making better buying decisions and basically give them the freedom and let them know it's okay to talk to your doctor or your hospital about price and quality, that is not out of bounds.
And it's amazingly something that you kind of bought into a long time ago, huh, Keith?
Well, yeah, I mean, we posted our prices online in 2009, and Jay and I met a little over a decade ago, and he doubled down and basically, I think, told all your clients, if you're not going to do it this way, you're not my client. Because it's just, everybody gets to sleep at night. It's win-win for everybody involved except for what Jay calls the black hats and bad guys. So, yeah, I mean, this, like we said before we went on the air, this proof of concept stage is over a decade old. So any employer, cost-sharing ministry, whatever the
individual patient,
patient, whoever the buyer is, can march into this movement with confidence that quality at a reasonable price is there.
Yeah, I was talking last week about really there's three directions that you can go at this time if you want to make that change. And I mean, there's more than that, but there's three very easy ones. Number one, you can join a health share. Okay, that one kind of takes some of the burden off of you, right? I mean, you think about that. They still do a lot of the work for you, right? That is a lot of folks are going that way. We're seeing a great movement that way. Another one is you can get something like an indemnity plan.
Right.
Okay. You get an indemnity plan and said, hey, I'm going to get paid a certain amount, and because I've got this, I'm going to have some cash that I'm going to be able to pay for it, so I can negotiate a better deal.
But I'm still price sensitive.
But right, and you of course are, because right, you're only getting so much
Right.
for whatever happened to you. And then the third is cash, because cash is still king. If you happen to be blessed enough to have the cash and don't need the indemnity plan and don't need the health share, and you're taking that money instead and you're putting it aside and you're diligent about doing so, you can also kind of self-insure. And if you're dealing with a hospital or a doctor that says, no, we don't do cash, we only take insurance, then you really don't want to do business with them anyway, because they're certainly not going to give you the best deal. And the numbers show you're not always going to get the best care and the best outcomes from that either.
If a hospital tells me that, I know right away that they do not view me as the customer.
Right.
I am a cog in a machine.
Absolutely. And I really believe that too many people have got lost in their card. Their card gets them everything. And we're not talking about a credit card. We're talking about their Blue Cross card, their Humana card, their United, whatever it is. This card, I give it, and it just gives me carte blanche.
That's right.
Because you're spending somebody else's money.
I can check my brain at the door.
Yeah. Yeah. And then whatever they tell me to do, I do. And wherever they tell me to go, I go. And I don't have options. And that's just not true.
Well, and I think the last figure, 50% of medical bankruptcies in the United States happen to people who have the card you just mentioned.
Right.
So it's not a guarantee that there's going to be payment. There's not a guarantee that there's going to be any kind of reasonable payment. There is a guarantee if you put that card down that it's not going to be a reasonable charge.
Right.
You can bank on that.
And not, it's not just that, but think about something happened right here in the Houston area where our listeners are, is it wasn't too long ago that Memorial Hermann and Blue Cross Blue Shield said, nah, we're not working together anymore. Imagine if you were in some treatment and that was your hospital and that was your carrier. And we all know that Blue Cross is the king in Texas. They got more people than anybody else. And so it wasn't just a couple of people that would have been impacted. We're talking about potentially thousands of people that were impacted and in treatment at a hospital that they can no longer go to unless they want to foot the bill.
Right.
If the folks at Blue Cross or United or any of these other companies cared about people, they would be in another business. So their business model is only consistent with the neglect and misery that the so-called beneficiaries receive. I'd also caution everyone when they see some dispute between an insurance company and a hospital, many times, I think Jay and I agree on this, it's largely theater.
Oh, yeah.
Because they work in cahoots. I mean, without the hospitals, without their PPO pals, that is a machine that requires both parts. So whenever you see that, I think sometimes there's some theater in that needs to have a heavy discount applied to it, as a PPOs would say.
Well, if you look at it, guess what they get to do later? They get to put the billboards up that's saying,
right,
now back with Blue Cross, yeah, right? It helps both parties at the end.
We got the band back together. You can all sleep easy now.
Yeah, that's right. Another one, Texas Med Clinic, went through this here a couple of years ago with Blue Cross, and it's kind of, and then whenever they came back, boy, it was everywhere. Everywhere
Ta-da.
you went, yeah, look at us, we're all friends again.
Yeah.
It's kind of a funny deal.
Call it negotiation theater.
Yeah. All right, hey, it's time for our first break. When we come back, we're going to talk some more about the movement that's going on and how you out there, yeah, you, the one listening right now, how you can join up. Harlan Pickett, Health and Wealth Power Hour. We'll be right back.
Whether you're an individual or a business owner, Eagle Care offers health plan payments around half of what most are paying in traditional insurance premium plans. Plus, you'll have the control to choose providers from one of the best provider networks in the nation.
During COVID, we had great coverage for our whole family. The day I signed up, we had a welcome call, and it was so personal and genuine. Plus, we went from $1,500 to $690 a month with Eagle Care. Thanks.
That is the Eagle Care way. Reclaim your freedom to choose and soar high above the rest. Find us online at eaglecarehealth.com. Eagle Care Health Solutions. It's not insurance, it's better.
Paul Berlin, a radio icon. His unique style and warm personality endeared him to so many. His endless stories and great music will never die. Paul may no longer be with us, but his memory will live on. KSEV is proud to continue with the best of Paul every Saturday evening, 6 till 8 p.m. Paul said it best as he closed his show.
We'll meet again at 700 AM KSEV in Heavenly, Houston.
Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Health and Wealth Power Hour. Thank you so very much for joining us today. We are live in Fort Worth, Texas at the Omni Hotel, the location of the 2022 Free Market Medical Association National Convention. What is that all about? Well, it's exactly what it sounds like. We are huge proponents of a free market. Imagine that you didn't have a free market when you went and bought a car. You showed up at the dealership, you chose the one you wanted, you left, went home with it, and they sent you a bill later. That's what you're doing whenever you show up with that card. Now, remember, No Surprises Act. That took care of all this, right, guys?
Oh, absolutely not.
It is amazing how many people have told me that, well, they fixed all of that.
Right.
Well, did you actually read anything about it? Well, it says no surprises. Well, that's the first surprise.
That's right.
Well, it actually is named appropriately. The No Surprises Act is one of the first health laws passed that does not have a deceptive name. You know, HIPAA is not about portability or privacy.
Correct.
I mean, the Affordable Care Act is not about affordability or care.
No.
The No Surprises Act, no surprise, the government screws it up again. So, for once, they name one without deception.
That is a very good point.
No surprise.
You know, it's like every time they have a chance to do something right, they just can't get over themselves. And I think a lot of this happens because most of the people that make these laws don't use the system. And if you don't use a system, then how do you know what's wrong with it? And I think that's just a big problem.
It's a huge problem, and not only that do they generally not use the system, but most of the politicians won't spend the time to actually understand how this system really works. We've spent a lot of time trying to educate, legislators in Oklahoma and even Texas, and they can only stand about 5 minutes of it, and their eyes roll back, and they're off to something else, and it ends up where they make really, really poor decisions. The whole No Surprises Act, we look at, it really addresses what I like to refer to as subcontractors in your care. I mean, you're going to the right hospital, supposedly. You're going to a network hospital using a network surgeon. But an anesthesiologist or a radiologist is not in network, and there's the surprise. Well, at Dr. Smith's shop at Surgery Center of Oklahoma, as the facility, he pre-negotiates with these subcontractors because he's the point of sale, and he comes up with a bundled upfront price that includes all of that. as the seller, it's his responsibility to negotiate with his subs, just like somebody that's selling a house or a Ford Motor Company is selling a car. They have to negotiate with the tire manufacturer ahead of time, because you're not going to allow to get a surprise bill for the tires that were part of your new car.
Right. It was fully listed, right? If you knew that you were getting the upgraded tires and wheels, the lift, or whatever it was right there. It was in the price. You knew it was there. Okay? It wasn't later on that you said, oh, well, yeah, it was this much. But if they tried to do that, most people are just walking away.
You would never buy that from that car manufacturer.
And so, Keith, why don't hospitals do it the way that you do it? Why don't the guys out there? It seems real easy the way Jay just explained it. Why don't they do it?
Well, there are two models in this industry. One is how do you maximize revenue, and the other is how do you deliver maximal value. The reason they don't do it is they're in this how do I maximize revenue model. It's all about how do I squeeze every single drop out of this turnip before there's nothing left. To do business in an honest way, where there's mutually beneficial exchange, and you say, here's what I do, and here's the price tag that's attached, market judge me, come in and purchase, and we will deliver what we said, or walk away if you think that is not a value. Hospitals not only don't want to do business that way, they have spent hundreds of millions of dollars in lobbying to ensure that they never have to do business that way. And we can bash hospitals, but we have to remember the ultimate culprit in all of this is the federal government, because that's where all these favors are auctioned. So I tell people, there are all these bandits and thieves running around, but Uncle Sam's driving the getaway car in every single heist. So yeah, they don't do business the way I do because they're completely focused on revenue. I can't do business that way because Jay won't buy from me. Jay's competitors won't buy from me. Individuals won't buy from me. People from Canada and Alaska won't travel to Oklahoma and buy from us if we did business that way. So we're actually in a market where there is some discipline to which we have to adhere.
Yeah, it was very interesting when I came to visit you at your center last year. Whenever you went through the process of how you did the pricing, I want you to talk about that again, because it is so basic the way that you did it, but so out of the norm. So it just blew me away, because that's what it cost. And then you went to your people and said, well, how much do you want to make? No, it just go through that again, because I was just blown away.
Well, yeah, that's where I started. I asked a surgeon, how much do you want for a knee arthroscopy? How much do you want for tonsillectomy? How much do you want for a cochlear implant, a hip replacement? And their eyes crossed. They had no idea. So they had to go to school and kind of figure out what they thought was reasonable. And eventually, they all have come to this conclusion that they're placing a value on their time. There's a tweak that involves expertise, but they're basically placing a value on their time. As an anesthesiologist, I basically bill for my time with a few exceptions for expertise. I'm not going to charge the same thing for a 5-month-old child as I am for a healthy 23-year-old adult. I mean, that's more difficult, and it ought to have something else built in.
Sure.
For the facility, I'm sorry, it's time and materials. So how long is this case going to take, and what are we going to use, and how much does that stuff cost? And then you add a pad to it, because there is some uncertainty. We're on a bell curve, and some cases are going to blow out and cost more, but most of them, if you're good at what you do, are going to be
the key.
Are you going to make more money? So in the end, the ones that go over, you just eat that and learn your lesson, and either that surgeon ought not to be doing that, or we ought not to be doing that case. Somebody else is more efficient, and so I'll send them somewhere else. But yeah, you just add those things up. I mean, it's anesthesia, facility, surgeon. Sometimes it involves radiology, pathology, physical therapy, pharmacy, home health. I mean, you just add all those things up. It's not even algebra. And then you get a number, and I'll post it online. And then if I'm wrong, I'll change it.
Yeah.
So look back, and how did we do on this? And you look back, and well, no, we missed it there. Actually, we're too high. So I've lowered many, many prices. You just change it, and you figure out how well did I guess on this. But that's what everybody else does in every other industry.
Yeah, but you don't punish the person that you just got it wrong.
Oh, they'll never come back.
Right.
But no, that's wrong. That's just unethical.
But they do it all the time.
Of course they do. I don't.
No, I'm just saying, but that's
yeah.
what the industry does all the time.
Well, Dr. Smith explains it, very eloquently, and they runs the surgery center very much like, a hardware store or like any other industry. And most other sellers, if not all other sellers in this economy in the United States, they work very diligently to make their product as easy to understand, as easy to compare, and easy to buy as possible. Not in healthcare.
Right.
They actually benefit by making, to answer your question from earlier, they actually benefit when it is so complex that you cannot easily comparison shop. So the ability or the willingness to bundle their services into what we've come to call a logical healthcare bundle. What does it cost to fix my leg? What does it cost to do that tonsillectomy? The layman does not understand all the questions that they need to ask.
Right.
But the seller does. The seller absolutely understands what all goes into a tonsillectomy. And if it was a functioning market, that seller would pre-bundle and come up with a unitized price, including the risk priced into that ahead of time. But not only is complexity, go into their favor, but we've also touched on the quality aspect, and that is when it is a fractured price and it's not a guaranteed bundled amount, any mistakes that occur or overtime in the OR or whatever, those are all billable. And employers and patients, they just see that, oh, my, that was a more difficult case, and so it's going to cost me a lot more money. There's no incentive for them to be better at what they do. In fact, they win when you lose.
Yeah, no, absolutely. And it's so interesting because you look now, they're all required to post their price, right? Price transparency.
They're required to post a price, not the market price.
Oh my gosh, it's laughable if you go and look at some of, and of course some of them are just not even doing it. Still, doesn't matter.
Most are not.
What are you going to do, right? And
right.
Once again, it's a failure of the government to.
The biggest players can pay the fine.
Yeah,
and we predicted what would happen. He predicted part of it, and I predicted the rest. When the government mandated transparency, he said they'll redefine it. to what is the patient's out of pocket, and that's exactly what they did.
Of course.
And I predicted that unscrupulous legislators, which is all of them, would auction off exemptions.
Yeah.
They would sell indulgences. That's exactly what they did, because the big boys can pay the fines, so they're just paying the fines, and the little guys, they're getting crushed because they can't afford the fines. So it's just yet another consolidation move.
Yeah, if they feel a little bit of pain from it, then they just roll it into the prices more, right?
Absolutely.
Let's roll the fine into the prices and kick that up too.
Yeah. The additional cost of doing business, right. And you're going to pay.
Yeah, exactly. I mean, you always see these, or I do. I pay attention to these, and I know certainly you do, Jay. These certain hospitals that charge 13% more, or 13 times the cost of Medicare, and they charge these crazy numbers that are out there, and you just wonder why would anyone go there? And that is a great question. I think, why would someone go someplace that is charging substantially more than other locations? And when we come back from this break, we're going to answer that question. And I think you're going to be surprised, and I think sometimes you're going to look in the mirror and say, oh, wait a second. That was me. You just talked about me. Harlan Biggett, Health and Wealth Power. We'll be right back.
Got FESA? That's the Federal Employee Service Association. Find out what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Feels like my first breath of retirement, and it feels good.
This is Harlan Pickett. My friends at Fessler believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go Fessler at gofessler.com. We help Americans retire.
KSEV and its advertisers want to thank you, the listeners, for all your continued support. Without you supporting our advertisers, there would not be a Voice of Texas. We stand behind our clients, and if you're looking to boost and grow your business, join the great team at KSEV and its loyal audience by calling a member of our sales staff at 281-588-4800. That's 281-588-4800. KSEV, loyal listeners and dependable advertisers are the Voice of Texas.
Got a question for Harlan? Phone lines are open now. Call 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett for Eagle Care Health Solutions. Because of the American Rescue Plan, you may qualify for reduced health insurance costs or even a zero premium. Let us help you secure your savings by taking action now. Just contact us here at Eagle Care Health Solutions, online at eaglecarehealth.com. We know getting good, affordable coverage is hard. Eagle Care makes it easy.
Don't miss your chance to reduce your health insurance payment. Government estimates $50 per person per month savings. Go to eaglecarehealth.com.
Wow, that's been good to me so far. That's a good one there, Gary. Harlan Pickett, Health and Wealth Power Hour. It is great to be with you today. We are live in Fort Worth, Texas, the location of this year's Free Market Medical Association National Convention with the co-founders, Mr. Jay Kempton and Dr. Keith Smith. It is a pleasure to have you guys on board today. Thank you so much for being with us.
Thanks for having us.
And when we took our walk to the break there, we were talking about who it is that goes to locations that charge substantially more. I think a lot of times people don't pay attention. And it reminded me of a story of my mom saying that she had a coworker that had this Chevron card, gas card. When she needed gas, she just stopped at Chevron. And she said, well, why do you go to a Chevron? They're usually more expensive, and especially the one there close to the office they were always 30, 40 cents more than everyone else. She goes, well, because that's what I got. I got this Chevron card, and so that's where I go. Well, that reminds me of someone who's got that card for Humana or Blue Cross or Aetna. Where do they go? Wherever my doctor told me to go, or the closest place it takes it. Or there's no shopping there because you're spending somebody else's money. But here I think is something that a lot of people don't think about, especially if you're using an employer plan. Now, we do want to talk about the market going towards individuals, but here is a big part that a lot of folks miss. I work for this big company. Man, we got great insurance. I just go where I want to because it just doesn't cost me a whole lot anyway. It's great. But what's happening is you are having a direct impact on the cost of your employer's insurance and the rates that are going up, and therefore you could be impacting yourself not getting a raise because you're spending someone else's money. No, you're spending your money.
And not only are you not getting the raise, but next year your health insurance plan is not going to be as good as it was before because your deductible and your out-of-pocket is going to go up. But Harlan, you make a great point. There's a huge gap between the cause and effect of being taken advantage of from a hospital that charges 1,300% above what they get paid by Medicare. There's a disconnect between that purchasing decision and a year from now when the amount of dollars that come out of their paycheck to pay for the health plan, or the fact their deductible went up by another $500 or another $1,000. It never gets related back to that purchasing decision. And when it comes time to make the purchasing decision, I'm spending somebody else's money, or this is where my doctor said I was going to go, or it's the biggest hospital, and of course the biggest must be the best.
Right. Well, I mean, it's got this big name. I see them on TV all the time, and they support the March of Dimes, and so that's where I'm going.
Where do they get all that money? Oh my gosh!
Where could that be? You said something earlier, Keith, that I had to laugh at, and I'm sure most of our folks get it, but we have had some folks come from California here recently, and so they may not really understand what you mean when these people are in cahoots together. So what you mean by that is they're benefiting one another by their actions.
Yeah, I mean, hospital has a big bill. The insurance company applies their mythical discount. And then the insurance company, in all likelihood, charges the employer a percentage of the savings that they achieved. And no one's discussing the fact that that payment was pre-negotiated. There actually is no savings. And then everyone gets fleeced. And the hospitals write that off as a loss, and that helps maintain the fiction of their not-for-profit status. And then Uncle Sam kicks money back to them if they claim those losses. So it's a complete scam. And they are in cahoots, and that's a perfect word Californians
really
need to learn.
Yeah, it really is. So I have a question that maybe you can answer. And you're a standalone facility. You're not a hospital, correct?
That's right.
You're a surgery center.
Right.
As a general rule, from what I understand, is having something done at a hospital will typically cost you more, let's just use an MRI, than a standalone facility or having something done, say, at an ambulatory or surgery center.
Even if things go well there.
Even if things go well.
Sorry.
So why? Why is it going to cost more at a hospital than at a standalone facility? Why?
Well, because they can charge more. I mean, it's because they can. They'll say, our costs are high. Mm-hmm. Well, yeah, your costs are high. You're buying physician practices. You're buying out competitors. You're buying ads during the Super Bowl. You're giving money to all of these charities and buying full-page newspaper ads to splay it all out there. When someone sees, for instance, that a knee arthroscopy at our facility is $3,740, that's what it costs to do that procedure. We don't buy expensive advertising or buy out competitors or buy physician practices. If we did that, then I too could say that our overhead was high. But that's why it's high. And keep in mind, the vast majority of these price gougers don't pay tax.
Right.
So you can double any kind of revenue number you see essentially with that. So it costs more. It doesn't really cost more. They just charge more. If they acted like a business and had to face market pressure, then their overhead would go down.
I was going to say, Dr. Smith, I can't just leave that softball just hanging there. One of the reasons, you just mentioned, why are their prices so high? And many times the excuse is, well, our costs are so high. Who cares?
Right.
Since when is the seller's inefficiency and high overhead
right.
the buyer's problem? I mean, I don't know about in Texas, but I know in Oklahoma where we're from, you occasionally hear a radio ad from a car dealership that's in Bristow, Oklahoma, which is a small rural community, and they'll say, we don't have the high overhead of the big city dealership, so come buy from us. We're cheaper. That's the exact same analogy in the hospital. It would be almost like the hospital saying, come buy from us. We're a lot higher, but it's because our costs are so much higher. I mean, again, nobody would be like, that's nothing to be proud of.
Right, and the outcomes are not better. That would be a different thing, right? If you went here and you're paying more, because remember the old saying, of course, you get what you pay for. That's not the case.
It's not.
In this instance, that is not the case.
Well, you get all the complications you pay for.
Yeah. Well, and how many people end up sicker coming out of the hospital than they were when they went in?
And who does that benefit ultimately?
Right. Yeah,
the hospital.
Right.
Return customers.
Right. Exactly.
That's an important point, and it's important for people to understand. High prices just mean there's not much competition going on.
Right.
Lower prices means there's competition going on. Somebody's in there mixing it up. And if you have competition, then quality improves. If you have one hospital in town and there's no competition, it's expensive, and they don't have to be any good. They're the only hospital. So competition has a very predictable effect on price and quality. So in this dysfunctional market, you actually don't get what you pay for. It's the opposite.
And one of the things that I do want to point out, I mean, you're a great example, Dr. Smith. There are options out there. If you are ready to take control, if you're ready to be part of the movement and not live in this system, you can do something. Whether you're an employer, whether you're an individual, it really doesn't matter. As you said, the model has proven itself. It's there. It is. There are places to go. In Oklahoma, obviously, where you are, in Texas, we have the Texas Free Market Surgery Center. We have a number of doctors. The direct primary care model is an outstanding model and is proven to have outstanding results, less hospitalizations, less complications, better results with diabetes, and multiple other situations there. And now, of course, we've got a kind of an up-and-coming, that's the direct specialty care model that is starting to really pick up. And that's going to be a game changer in a lot of people's lives, because those chronic conditions that people deal with day in and day out, and I mean, you think about what happened, of course, during COVID with people not getting the care that they needed, and just their situations getting worse and worse. If they would have had a direct specialty doctor at that time, been one of those and a member of one of those, so many things could have been taken care of virtually and over the phone, because that doctor knew you so well.
That's right.
That there wouldn't have been a gap in the coverage. And I think it has helped, that COVID helped us be more accepting of tele and also virtual.
Alternative care methods, yeah.
Yeah, I think it really has. And I've talked to a number of doctors that have kind of stepped away from a traditional practice that say, I'm going to do this, and I'm going to do this almost 100% tele. My wife and I ran into somebody in Vegas at one of the conventions we were at, and they're doing a complete holistic GI service, all virtually. It's amazing when they talked about everything that they can do through that. You know, their thing was, most times when you go see a GI, what's the first thing they do? You need to get a colonoscopy. You know, you need an upper and lower. We can't really know anything until then. And he says, that's just not true. Let's talk. Before I start sticking things in you, let's talk. Let's talk about what's going on. Let's talk about your situation. And we're gonna this flat, everyone pays the same, first of all. So I know you're gonna like that. Everyone pays the same.
What a concept.
What a concept. Okay? And it includes all of these things. So it's all the way. It's all the way from counseling and coaching, dietitian, nutritionist, your actual GI, all of those things together that really are what's your problem, right? Because we don't know what it is, but we're going to have everything as part of it.
Holistic solution.
It's a holistic solution. It is a cure, not just treating the problem. To carry on, and we haven't even got into the pharmaceutical side of this thing yet that helps drive the cost up, and it really is the biggest driver of our cost right now. One of the things that amazed me is that we had the biggest increase in Medicare costs this year that we've had in a long time, and half of that increase was based on a medication that they expected to come into the market.
Scary.
It is. An Alzheimer medication that had not even been approved yet, that was still in a testing phase, but they expected it to come into the market and cost so much that they went ahead and increased the cost of Medicare to take, and of course, the medication has not been approved.
Right.
So that means the next year we're going to go down?
No.
No. Well, we know better than that, right? The costs never go down.
I've been in the business for 30 years, and I've never seen healthcare inflation even flat.
Right.
It's always been positive.
Even when it's a small amount, it's always going to go up.
Yeah.
It is time for our final break. When we come back, we're going to talk about more how you as an individual can really start taking advantage of this. And we're also going to talk about some significant changes that are going to happen in the government's control of this. The ACA, we're going to talk about what's going on with that, and some changes that are going to happen for next year, so that maybe you start getting in the frame of mind and knowing you need to get with the program. Harlan Pickett, Health and Wealth Power Hour. We'll be right back.
Got FESA? That is the Federal Employees Service Association, and they've been assisting federal employees and the private sector with their retirement benefits for more than a decade. helping you understand your benefits, ensuring that you are not paying for benefits you don't need, and that you will receive the largest retirement check while paying the least in taxes. That's what FESA can do for you. A recent client had this to say.
Joy took what felt like a 12-lane highway heading off in all different directions, and it turned into a single-lane country road. Ah, feels like my first breath of retirement, and it feels good.
This is Harlan Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Want to be part of the conversation? Phone lines are open. Call now, 281-558-5738. That's 281-558-KSEV.
This is Harlan Pickett. My friends at FESA believe in the old saying, what goes around comes around. By helping people at no cost to them, many times they can retire earlier than expected with an income they cannot outlive. Go FESA at gofesa.com. We help Americans retire.
Catch Chris X Radio weekdays at 4.
The word racism or a variation of was used every single day in April by hosts and guests on MSNBC.
Racism?
Racism.
Racism.
The racism.
Systemic racism.
So overtly racist.
Structural racism.
Racism and sexism.
Systemic racism.
Very racist.
At least they aren't trying to push a narrative or anything.
Chris X Radio, weekdays 4 till 6, right here on the Voice of Texas.
Eagle Care health plan options are about half of what most are paying for a traditional insurance premium plan. Plus, having control to choose providers and real help getting your health needs met at the most optimum outcome.
Reclaim your freedom to choose. Soar high with Eagle Care. Find us online at eaglecarehealth.com. It's great to be with you live from Fort Worth, Texas, as we are at the Free Market Medical Association National Convention with Dr. Keith Smith and Jay Kempton, the co-founders of this awesome organization. Hey, as we went to break there, talking a little bit about how you can make the change over to really taking control of your health care. And we need to talk a little bit about what's happening on the Affordable Care Act and in particular what's happening in the marketplace. And we're talking about the federal marketplace, our healthcare.gov, where you cannot actually buy healthcare, by the way. Yeah, I know, it doesn't make any sense, right? Why would you name something you can't get there? Because it's a government. That's the way they roll.
No surprise.
No surprise, once again. But what is happening is they're making some significant changes for carriers. Now, once again, a lot of times, as we mentioned earlier, they may have had your best interest at heart in saying, okay, insurance carrier, you can no longer just offer an HMO. You can no longer just offer plans where you want to, and you have to have more accessibility. You have to have more offers of plans. You can't just offer one kind of plan or two kind of plans. You got to offer the whole spectrum, bronze, silver, gold, platinum, and you can't just offer an HMO. You have to offer something else too. Well, it hasn't happened yet. It hasn't been announced yet, but these things, in my opinion, will drive competition down because less carriers will be interested in participating. We are actually, as far as I can tell, we're at a high of participants right now because what happened when the big guys left is the little guys got a chance. Okay, so you had your Ambetters and Oscar Health and some of the other Communicare. You had some of these guys come in to fill the gap whenever United Healthcare, Aetna, Humana, when all those guys left, like Assurant. Assurant didn't just leave. They just said, we're not even selling health insurance anymore. They just got completely out. Somebody had been selling health insurance for 100 years, just said, nope, we're done. That tells you how much they like the Affordable Care Act, right? They didn't even buy into you can keep your doctor, you can keep your plan. They didn't buy into it at all. They just got out. And that was really before everything completely fell apart. So that's kind of an interesting thing that they did there. But I think what we're going to see is we're going to go from this high number of choices. I didn't say good choices, but high number of choices down to a few choices again. just 3 years ago in Brazoria County, right outside of Houston, there was only 16 plan options from 2 carriers. This year, there's 10 carriers there, and there's 254 plan options in Brazoria County. Now, that's a little confusing, huh? One company, just one of the companies, offers 36 plans.
Wow. They're going to struggle with that.
I mean, the consumer is going to struggle with that. The company, yeah. I mean, why would you do it, first of all? It makes no sense. But the consumer can get lost in all of that. But why would someone stay in that world? Well, they stay in that world, number one. I understand now if you're low income and that's what you can afford, because maybe you have a zero-cost plan. Now, the negative side of that zero-cost plan is when you actually need to use it, you're scared to use it because your deductible is $8,700.
That's right. You're going to go bankrupt with the card.
Right. The other thing is you got to find someone to take it. Right here in the Houston area, MD Anderson, everyone knows, great cancer center. If you go out to their website, go to the insurance page. Right there on the insurance page, it clearly states they do not accept any plan on the marketplace. Not one. Now, Aetna has a plan on the marketplace. United Healthcare has a plan on the marketplace. And Blue Cross Blue Shield have a plan on the marketplace in Houston. MD Anderson takes none of those. Do you still think you got great care? Do you still think you're in control? If you were to call up MD Anderson and ask them how they feel about a health share, guess what they're going to say? We love it. We love working with a health share. They love working with a health share because they know they're going to get paid, and they know that they're going to be working with the patient,
right?
Not a big insurance company that's dictating things to them. They can work more efficiently, and there's going to be less overhead involved, actually, because they have less processing. One of the things I thought you might come up with when I asked you earlier why hospitals are more expensive is because of their overhead, but most of that overhead is administration.
Oh, yeah.
Administration. There's 10 times, if not more, administrators at that doctor than actually caregivers.
That could be.
It's an amazing thing. Yeah, it really is. When you look at the numbers, somewhere around 2012, the number of administration went up to like 1,700%, and versus caregivers at 3%. Between 2012 and 2020.
Got cheaper, didn't it?
It's like, what? Well, the reason is clear. Because, all of the ACA, all of the different things they had to do, all the compliance, HIPAA, all these things, we kept having to hire more people just to process our bills.
That's right.
Just to process the bills and make sure the right codes were on. Well, they get that wrong most of the time too, right? I mean, I thought this was a preventative colonoscopy. Why did you just send me a bill for $5,000? Oh, somebody put a 3 instead of a 4.
Yeah.
Keystroke.
It does. It does happen. And with the overhead, especially when the overhead is the people that are running the hospital, they certainly want to make sure that they're collecting enough revenue to pay for themselves.
Right. That's exactly right. But, another roadblock people run into when they have an alternative plan, whether they have that health share, or whether they have something like one of our Eagle Care plans, where we do use a network, whether it's PHCS or you use First Health, whatever it is, even if that doctor is in that network, and we ran into this ourselves with my wife, her doctor said, no, we're not going to take that. Well, why aren't you going to take it? Because they limit how much we can charge. Well, what are they paying you? Well, the fair market rate is the answer. That's not what they tell you. They say, well, they limit how much we can charge. Well, what they're limiting you to is what the fair market rate is. So you're saying you don't want to charge that because you get paid more if you use a traditional insurance plan.
Right.
And, Jay, I know you're real big on the reference-based pricing. We've talked a lot about reference-based pricing on the show before, and you build plans specifically built on that.
We do.
So tell us a little bit more about that.
Yeah, so of course, we try to do as much business as possible with our clients, which are self-insured employers with places like Surgery Center of Oklahoma that have an upfront price. There's no negotiation necessary. This is what they do, and this is how much it costs. But when we are not utilizing the services of what I would consider a free market, transparent medical provider, we will tend to use Medicare as a basis for payment. Certainly not an endorsement to say that the government gets pricing right, because we know it's wrong. Because it just is. But at least everybody knows we all come up with the same wrong number.
Yeah.
And our benefit plans will pay a hospital at a percentage above what they get paid by the federal government through the Medicare program. Generally, those percentages can be anywhere from 60% to 100% more than what they get paid by Medicare. Those types of plans, many times those transactions are made in lieu of any sort of a contract. So, through the PPO networks and those arrangements, generally speaking, those are contracts that are negotiated behind closed doors that the buyer doesn't have any access to. Reference-based pricing is kind of the same thing, because now the buyer is imposing a price on the seller. So I like to tell everyone, Harlan, that reference-based pricing is not a solution. It's not the solution. It's a conversation starter. Mm-hmm. In other words, if you won't post your prices, and I have no way of dealing with you, then we're going to use more of a universal starting place to provide payment. And if that's not acceptable to you, well, let's have a conversation. But instead of the conversation being a percentage off of what you chose to bill, it's going to be more of a bottom-up conversation from, we're going to start with what you get paid by Medicare and work our way up. If the conversation changes to cash, boy, now we've won, because now we're really talking about the universal language. But in lieu of that, using Medicare as a basis for conversation and negotiation it's a lot better than, again, negotiating a percentage off of an unknown starting point, which is the bill charge fiasco.
You got to start somewhere, right?
You got it.
And you're right. The Medicare number can be so different than what the actual charge is. I mean, you don't do Medicare, Keith, because that number is not a real number. I mean, you can say, okay, if you wanted to know what the real cost of doing this is, here it is. Medicare, where did they come up with that from? Well, it's a mystery, right? I mean, it's, once again, that same thing was held behind closed doors somewhere.
That's right.
Talking to our friends over at Green Imaging, Kristen even told me, the number that they pay for MRI, it sits so low. So it's the wrong way. In other words, it's not too high. It sits so low that she doesn't even know anyone who could do it for that. And they have incredible pricing.
That's right.
At Green Imaging. I mean, they are rock bottom, just doing it the right way. But even the Medicare number is crazy on that. So, but you're right. It just gives us a place to start.
That's right.
And that's one of the more important things, is you got to have a place to start. And guys, to get a place to start on this road, the Free Market Medical Association is the place to start. Get out there, FMMA.org. You can go to Shop Health and get all kind of great information on folks that are part of this movement. Start shopping for your care. Start taking advantage of the entrepreneurs and the folks that are out there striving for you to have better access to health care, not health insurance. They're not the same, folks. Health care. Closing comments, Keith?
Yeah, thanks for having us on your show. We appreciate your talking to the audience. And folks in Houston, like you said, can still get here. We'd like nothing better than for the Omni to call the fire marshal in, because there's too many people here. So thanks for having us.
Yeah, absolutely. And, of course, once again, folks, you can also go out to FMMA.org, check out the events, and you can still join virtually also. There are virtual tickets available.
You bet.
Closing comments?
Again, to echo Dr. Smith, thanks for having us here, and thanks for everything that you're doing out there, spreading the truth and helping people see healthcare the way they should see it, as opposed to the way we do see it.
Hey. All right, guys. Hey, appreciate it once again. Hey, we'll see y'all guys next week. Health and Wealth Power Hour, Harlan Pickett, we are out.
Thanks for tuning in to today's edition of the Health and Wealth Power Hour with Harlan Pickett. And don't forget to tune in each Thursday at 1 p.m. to find ways to access and keep more gold for your golden years. Because what it's all about is really enjoying those years and never running out of money on the Health and Wealth Power Hour right here on AM 700 KSEV.